I know there's a lot to it. It's complicated.
Yes. So I'm glad you're doing it
Hey,
on your side.
we're live. We got the streaming button, which is the streaming light, which means that it's working. Hey guys, thanks for joining us. So I got my friend Chris on the line with us, and Chris is a trauma surgeon. He's also an overlander. I've known Chris for a long time, and he's got quite a bit of knowledge about what you really need in a real world situation when you're facing trauma. And what we're going to talk about tonight is just what is. Oh, I got no volume. There's no volume.
No
Doug,
volume.
none. You got no volume. Let's see what Doug says. Hold on.
I can hear you on my end.
Yeah, Doug. Sorry, Doug. I think it's you. Chris is saying there's plenty of volume. They can hear me. So I think we're good. You scared me, Doug. All right. So we're going to talk about what's in your kit. And Chris, why don't you do a quick introduction and tell us some of your experience and why you have a passion for the trauma kit in your rig.
So I'm Chris. I have been, uh, overlanding for 30 plus years. I just started on feet at first, and then moved to cars a long time ago, and then it became a thing. So that's what I associate with. I've been
Like a lot
uh,
of us.
like a lot of us, yeah. So I have been a surgeon for 15 years. Trauma has been the focus during all 15 of those years with training and experience. And I teach a lot. I teach surgical residents how to be surgeons. I teach advanced trauma life support to physicians. That's a class that frontline ER docs and surgeons now have to take. It teaches you how to assess any trauma patient from the easiest, smallest injury to the most complicated, and really how to do that with a limited amount of resources. It's geared towards those frontline critical access hospitals that don't have ER docs. They've got the community doc playing ER doc for the night. And what do you do? So it really made me aware of, despite what I've been trained and all of the fancy toys I get to use, that you don't really need a whole lot to actually do a whole lot. So as we've gotten into this and I see what people are doing with their kits and the kits that are on the market and what people want to learn, there's a lot of great classes out there and there's a lot of good information, but the reality is it's not going to apply to everybody all the time. And if you just try to learn that one specific how to treat X, you're going to get yourself into trouble when you're faced with A through, Y and those kind of things. So, Michael and
Cool.
I started talking. He's got this big community and
Yeah.
just a need and desire to go out and just teach people the basics of trauma care so they can do something if they really needed to.
Yeah, and Chris has done some training courses with us. It's been absolutely fantastic. What I'll say really quickly is just knowing something, if you have not received any training, is going to go, I mean, just from my perspective, I feel a lot more confident if something does happen, on the trail. And Chris, you underscored something that I want to repeat, and that is that, if you try and focus on all the things, then you might not be as effective at treating a real trauma situation. You want to be focused with your thinking, and you want your kit, the kit that's in your rig, to be focused as well to treat a trauma situation. And that's something that you and I have talked about, quite a bit. What you can do when you're off grid and what you need.
Exactly. Yeah. It really just comes down to, and I say the basics of air has to go in and out and blood has to go round and round. And that's pretty much it. Other than that, there's not a whole lot to what we do. Different levels of training allow you to do more to accomplish that. But the number one thing, and given the unfortunate things that have happened in our country that we are experiencing with mass attacks and terror, that the American College of Surgeons has realized the value of the frontline people, which are the civilians, the people who don't have any training before paramedics show up, being able to actually stop bleeding. And so the campaign right now is called Stop the Bleed.
Yeah.
And it just focuses on giving people the confidence to do something. And
Yeah.
it doesn't have to be the perfect thing. It doesn't have to be what I would do. It has to be something. And anything makes the biggest difference in those situations. And where we are, everything we do, you're front line, no matter who you are or what you are. It's time before more help comes.
Yeah.
So it's just making people feel empowered to actually step in and have the confidence that no matter what they're faced with, it's a system that they can just march their way through and actually take care of what matters most in the order that matters the most.
Great. Hey, I'm going to mention to folks a couple of things while we continue to introduce Chris. Since this is the first time you guys have talked to Chris, we're going to take a little bit of time today, you know, finding out more about his background, but we are also going to talk about some of the problems he's seen with the kits that are out there and some of the things that you want to avoid. We'll get to that in a moment. If you guys have a question in chat, I am watching the chat stream a bit. And if you want us to answer a question, do me a big favor and put in all caps in brackets question. That way you guys can talk back and forth to one another, no problem. But then if you guys have a question for us, I'll see it come up if you do that. So, Chris, you've been doing some off-grid travel for so many years, and you and I have been on a couple of trips together as well. You've got this you've got an iconic rig behind you. Is that is that just a model? Is that something? Tell us why you got that rig. Tell us what it is, and tell us why you have it.
So that's the mini me of my big rig. That is an RC, I forget, 1/10 scale, whatever they are, Camel Trophy Defender 110. So I was fortunate enough to have the ability and the right time to buy an original Camel Trophy 110 about 8 years ago. So my fun car is that, and then when I can't drive that, I get to drive this. So this has been pretty good. My little girl who was here a second ago, she learned how to use the winch on the front, and I was very proud of her when she winched her Barbie car across the living room with it. So,
yep,
she'd rather play with the 110 than that. But yeah, it's it's like all Land Rovers. It works when it works, and otherwise I learn how to fix it.
Cool. I've got a question, I see you guys asking questions, which is great. Thank you. We'll get to a few of those in just a second. So you have a Camel Trophy Defender 110 right now that you drive on some of your trips, and it's a fantastic rig. If you guys want to talk to Chris about other topics than we cover tonight, I am going to say join him on our forums. He does moderate our first aid section. We want to have somebody with Chris's expertise moderating that section so he can give qualified advice in there. So you can catch up with him over on our forums in the first aid section. It's under boot camp. All right,
and
so
I'm
question.
Happy to take private messages too. Please, if
Cool.
you're afraid to ask in front of the forum group, and you just want to know, please. And one thing that you and I haven't talked about, Michael, but I do get asked is people with chronic medical conditions often ask me, how should they safely travel and what should they carry? If you do have a medical condition, you're worried about how to go off grid with it, let me know, because part of what I do is making sure I can take care of all those in the backcountry, and I've done my homework on what specifically I need for different things in the backcountry. So please feel free to ask me questions.
Cool. All right, so we got a couple of questions. The first question is from Chris, another Chris, and it says, at what point does your first aid kit become your trauma kit? And maybe we can join some of the problems with current kits with your answer. So the question again is, at what point does a first aid kit become a trauma kit? Go ahead.
So as you've heard, in my opinion, your trauma kit should just be your trauma kit, and it should never be your first aid kit trying to be a trauma kit, and your trauma kit should never be a first aid kit. I always talk about 3-kit system. So you need a small one for little things, you need a base camp, and then you need a trauma kit. And the reason is, and the issue with the bigger kits and the kits on the market that we've talked about is, when you actually have a real emergency and somebody needs something, the panic of trying to take out butterfly band-aids and gauze and things that don't actually matter and help you in that moment adds to the kind of the panic, to be honest, for people who aren't sure what they're supposed to do. And it clutters the kit with a lot of content, but you will quickly use that what you have that actually makes a difference, and then realize the limitations of your kit. Gauze is something that people never carry enough of. You'll be surprised how much you go through just for the smallest of things. And if you're talking a 4 or 5 day adventure and day one somebody gets hurt, checking the wound, keeping a fresh dressing on out in the woods, you're going to go through a lot of supplies just for one person. So your first aid kit really needs to be first aid, boo boo stuff. And then your trauma kit needs to be trauma, only trauma. Everything that deals with what we teach with the airway, breathing, circulation, the ABCs, and how to approach things, and laid out that way so that whenever you can just open it and you just go right to what you need to.
Cool. Now you quickly mentioned base camp kit. So you mentioned three things. You said, hey, you need a boo boo kit. That needs to be the small stuff. You need your trauma kit, which needs to be focused. And then, what do you mean by base camp kit?
So, as exciting as it is to think about being faced with these emergencies, the reality is normal things, upset stomach, diarrhea, constipation, dehydration, fevers, colds, those are things that kind of put a damper on most trips. If you ask anybody, their experience is probably going to be in line with that. So, what you need is kind of like a mobile medicine cabinet, stuff you would have at home, things to make your trip a little bit better. If you get sick or just not feeling well, and that's where your medicines can be that treat all those kind of things. So base camp is really something that can be tucked away in the truck. It doesn't need to come out quickly. It's when you're all set up, someone's not feeling good, and you can take care of it. And I actually tell people you should also keep a couple little things for emergencies in the base camp, because if you're at camp and somebody falls and gets hurt and it's not that big a deal, you don't want to take supplies from that trauma kit. You want to take them from base camp because that's not an emergency. But keep that trauma kit fully stocked for when you're driving down the road and somebody gets hurt or you have a major emergency that you need all those supplies.
Cool. Thank you. Hey, John is asking, what is the baseline first aid class you recommend for overlanders?
So, to be honest, the Red Cross puts on a good just first aid course. They do have a wilderness first aid class if you can do it. I think those classes, like I said, the classes are really good. So the content you're going to get in those things is going to really put you on the right track. And they're going to give you a broad overview of how to care for a lot of things. But that's where I would stick with. We're going to put some content together for classes that were really focused more on like the emergency trauma type stuff, which most of those classes don't really give you this. The one class that does is that advanced trauma life support, but that is for physicians, medical personnel. It's an expensive class, but we're going to kind of just put it together for you guys because I think it's important for people. But Red Cross first aid, that's where I would start for anybody who needs something.
Right on. Cool. So one of the things that we've talked about is that you want to snap people out of the preconceived notion that they're going to fix everything or that they're going to be prepared to cure or solve or fix the problem when they're out off the grid. And, really the job is to get that person from the situation they're in back to a hospital or back to civilization where they can receive more in-depth care. Is that correct?
Absolutely. Yeah. No, absolutely. Part of your assessment is, do we need to evac, get them out, get the help, and did that help need to come to us or do we need to go to them? And that's going to depend on where you are, what you have for communications. I highly recommend, and I have no sponsorships, just so everyone's clear, but I highly recommend the DeLorme InReach. It's a two-way satellite texting. It's not that expensive every month. You can get sort of seasonal packages, and it's just peace of mind to be able to go back and forth, call for help if you need it. But yeah, really, even with what I carry and what I'm capable of, I would pull the trigger to get somebody out quickly. Yeah. Because in trauma, we talk about the golden hour, which is the first hour of injury, and that's where you do the most stabilization. But if you look at it, we're all really good at what we do in the first hour. What separates out survival and non-survival is how you get that first hour going, but then the next 23 hours. So you may get them stabilized, and that might be great, but it's the physiologic changes, the shock, the things that come after the injury that are going to make the biggest difference in survivability. So you need to get people out, and you just need to stabilize as best you can and get them to a proper facility.
Right on. Hey, so there's a lot of stuff out there. Uh, what are some of the, from your experience, some of the preconceived notions, or maybe some of the things that are um, not okay or not as ideal as they need to be with current kits that are on the market?
Uh, I mean, the biggest one comes that they're trying to do too much. Like all the
Yep.
good kits, all the name brand kits, all of their frontline kits, they've got base camp medicine, they've got band-aids, they've got some trauma stuff, and they're good. I mean, they'll do the job, but when you actually have gone through this, and some people have, and you know nobody wants to. I don't even want to, but
Yeah.
you realize the limitation of your kits very quickly, and most people see the frustration. And the more training you have, the more you realize the less you actually need. So, number one, I would say is that the kits give you a false sense of confidence by having a lot of things and telling you can do all these things. And then they don't they don't back it up the way that they should in the respect that they just sell you this kit and then let you go about it.
Hmm.
Some of the sites are starting to put some training websites out there to be fair to them, but again, there's not a lot of support for the kit. They just kind of assume everyone knows how to put a band-aid on, but that's not the case in an emergency. We all can take care of little things, but it's those big ones that make the biggest difference that you really just need to be able to focus. So when you design your kit, you really want it to focus on the ABCs: airway, breathing, circulation. How do you keep air going in and out, and how do you keep blood going around and stay in
Yep.
place where it's supposed to? And anybody, honestly, I mean, I can give you a 30-minute talk and you will feel like, okay, I can go do that, because that's it. There's nothing complicated about it.
Right on. Hey, so I've got a question here from Eric. He's asking, what about meds? How do you go about getting How do you go about getting antibiotics or something that's not, readily available?
So that's just between you and your doctor, to be honest. Talk to your
Yep.
primary care doc. Tell them what your plans are. Tell them you're planning to go out and do something. And they may be inclined. There's a lot
Hmm.
more regulation on things. Antibiotics are pretty easy to come by for the most part, especially if you just have a good, honest discussion with your physician about what your plans are with them.
Yeah.
But in all honesty, unless you exactly know what you're doing and why you're doing it, antibiotics, I'm thinking, unless you have a known medical condition that you would take antibiotics for from time to time, I presume you're talking about treating like a cut that gets infected. And to be honest, if you wash it every day, you keep it clean, you don't try to close it unless you know exactly what you are doing, you don't need antibiotics. That's the reality of it. So, I mean, unless I was traveling for a really long period of time in a third world country, I don't even carry antibiotics, honestly.
Got it. So question, your opinion about super glue for wound closure?
That goes back actually to the last one. Super glue is technically different than the glue we use in the operating room and the emergency room. It fuses the skin differently at a cellular level. It's not wrong, but what you have to remember is that all wounds heal from the inside out. So unless you know that you have properly sterilized that wound, putting glue over the top of it, you've just sealed bacteria into its perfect condition.
Hmm.
It's got no oxygen, it's dark, and it's got plenty of blood cells flowing around. So you're actually more inclined to give somebody an infection. I wouldn't use it. I don't carry it in my kit. Keep it at home for my kids and myself. But in case of emergency, you want to put it in a disaster kit. I think that's okay. But honestly, most wounds, if they're deep enough to need suturing, you probably just need to head to the hospital.
Yep. Got it. Got it. Okay. Um, so if somebody's going to bring, if they're looking at their current kits, what are some of the things they want to be sure to have? Like you just crack open your kit, you see this video, you want to do an assessment, you crack open your kit. What are some of the things that you want to make sure that you have enough of, or what are the elements?
So, if you're going to talk about a trauma kit, which is the emergency one, absolute minimum is a CPR mask and a proper full size CPR mask. That's your airway and breathing.
Hmm.
Learn how to use it. Learn how to make sure the airway is clear. Visually look in. Don't go blowing things down. and making the situation worse. But that's your A and B. And carry at least one. And if you feel like carrying two, carry two. If you travel with four people, carry four. But that's your number one because it's going to
Yeah.
be airway. The next thing really comes down to circulation, which is bleeding. Tourniquets, you need probably a minimum of two. I usually carry two per person just in case. And then some kind of compression gauze. The Israeli tourniquet, Israeli trauma bandage is a really good one.
Mm-hmm.
It's basically an ACE wrap with some gauze, and then a fancy little bar to help you apply more pressure. Side note, they all have expiration dates due to the FDA, but they're just gauze, so they are safe to use past their expiration date. So if you find somebody selling a bunch that have expired for really cheap, buy them because they don't expire ever, even if the vacuum packaging is violated. And then, to be honest, if you just had those three things, you will take care of pretty much everything you can take care of in the backcountry.
And again, we underscored it's about getting the person back to care if they have a really life-threatening injury.
Yeah.
Yep. Right on. Okay, if you guys have questions, again, put question in the brackets. We're glad to answer them. And Chris can also talk to you guys in a little bit more depth over on the forums at Overland Bound. He moderates that section and is glad to talk to you guys. Chris, what else? What else should we cover today before we sign off? Anything else that you have in mind?
I mean, all I can really stress to people is take some time to look at your kit, whatever kit you buy or want to put together. Really focus on what's going to make the difference in somebody. You can Google ABCs of trauma and learn it. It just goes through what really makes a difference, and just kind of keep a mental inventory of what's going on and really try to break things up into 3 separate kits: the boo-boo, the base camp, and the trauma kit.
Right on. Okay. So that differentiation for me between the boo boo kit and the trauma kit was enlightening, right? And it allows me to focus and put together the right stuff. We've got one question, and that is, are inflatable splints still used?
Actually, yeah, they are. We've actually transitioned from a lot of places from the hard, rigid backboard to an inflatable cocoon. So that tells you that we still use inflatable splints for everything. They're small, they're easy to use. I don't personally carry them because I just carry some SAM splints. But yeah, if you've got them and know how to use them, inflatable splints are appropriate.
Cool. And Chris is asking a question: how do you immobilize a person for emergency travel on a rough trail?
So immobilization is it's kind of it's a tough topic to fully properly cover. I'll give you the brief history. It used to be anybody that got hurt got strapped down to a backboard, C-collar, fully immobilized. You could turn the board all different ways and they didn't go anywhere. And then we found that caused its own problems, especially for long travel. People had skin breakdown in the back of their scalp and their shoulder blades, all the contact points. So most counties, at least around where we work here in Alameda and Northern California, they've swapped to, if the person gets out of the vehicle themselves at the scene of scene of the accident, and they can walk around, they do not need to be immobilized. Yeah. So if you're really worried about them, I honestly would just put towels or pillows next to their head as best as possible, tape it. And unless they have neurologic symptoms where they feel numbness or tingling or can't feel something, I wouldn't really worry too much about fully immobilizing them. I would try to limit how much they bounce around. But, if you're really, really worried, have help come to you. That's the best thing.
Right. Got it. If you can.
Yeah.
Chris, for folks that have just joined, again, give us just a quick summary of some of the things that you do professionally.
Professionally.
Yeah.
So
You're not just my buddy that I met down at the,
So I am a trauma and general surgeon, and I work as a flight surgeon for the East Bay Regional Parks on their police rescue helicopter. That's professional stuff.
Yep. And you've been off grid for
trauma
many.
life support teacher.
Okay, cool.
Yeah.
And you've been off grid for a number of years. You have a passion for overlanding as well, and so now you've kind of combined the two.
Yes.
And he's available to answer you guys' questions. There are some things specific to overlanding, and Chris's courses that I've gone through have been really great, Chris.
Thank you.
All right. You guys, I think we've been on probably for about 20 minutes or so, 25 minutes. And so I'm going to wrap up now. Chris, hey, thanks for joining us
Sure.
and
Anytime.
offering your insight. And you guys, again, you can talk to Chris over in the forums in the boot camp section under the first aid. He moderates that forum, and he'll check in there. Also, Chris, I imagine you'll answer some questions in the comments of the video over the next 48 hours or so.
Oh, didn't even see those, so you'll have to let me know where they are.
Yeah, I will give you the link, and you can check
Perfect.
it out.
All right.
All right.
Yes. Well.
Yeah. Hey, Chris, thanks a lot. We're going to sign off now. And you guys, if you have any further comments that we didn't get to while we were talking to you, just put them in the comments underneath the video, and we'll try and get to them. All right. Thanks a lot, Chris.
All right. Bye, Michael.
All right. Bye. See ya.